Hello friends, I am Dr. Ankit Sharma, consultant urologist at Manipal Hospital Kharadi, and I am here to talk to you about prostate-related symptoms and their treatment. Benign prostate enlargement is a very common disorder which affects 80 to 90% of men within the age of 60 to 70 years. Generally, these men suffer from poor stream of urine, frequency of urination, urgency, that is the inability to hold urine for too long, nighttime wakings to pass urine, and a sense of incomplete emptying after passing urine also. These are all some symptoms which these men present to us with, and there are certain therapies which we tend to offer them. First and foremost, we try to manage all patients on medical therapy. However, medical therapy only goes so far, and eventually these patients will require some form of interventional therapy. So what are the therapies that we tend to offer them? So there are two procedures which are the conventional procedures which we have been performing for quite a few years. So first and foremost, and the gold standard and the oldest procedure which we perform is TURP. So what do we do in TURP? In TURP, we tend to shave the prostate gland using an electric current and make sure that the prostate passage remains wide open. This is a very minimally invasive procedure in which there is no cut or stitch on the body, and the patient requires a 24 to 48 hours of in-hospital stay. The second procedure, which is the most commonly performed nowadays, is the laser prostatectomy or TUFLIP. In this procedure also, the prostate gland is removed with the help of a laser. This is a relatively bloodless procedure, and the recovery is also much faster than TURP. Both these procedures are commonly performed, however, and they have certain side effects which is known as the retrograde ejaculation, wherein the discharge post-ejaculation tends to be reduced. Majority of men don't want to change their ejaculation and don't want to undergo procedure to avoid the retrograde ejaculation. So for these patients and for the select patients who are still sexually active and want to bear children, there is another procedure which is nowadays available. This procedure is called as UroLift. So what is this UroLift? UroLift is also an endoscopic procedure which is performed most of the times under local anesthesia or under sedation, wherein endoscopically we put in a few implants with the help of this gun. These implants are nitinol implants. They remain in the passage and tend to open up the prostate, relieving the patient of urinary symptoms. This procedure is a very durable procedure with a reprocedure rate of less than 10% at 10 to 15 years, and it is a very safe procedure requiring an in-hospital stay of less than 24 hours. If you feel that you or some of your relatives are suffering from any of these problems and want to seek treatment for the same, please feel free to reach out to us at Manipal Hospital Kharadi. Thank you.